Hello friend, welcome to my channel. Today we start Azygos vein. Azygos vein drain the thoracic wall and upper lumbar region. Thoracic wall and upper lumbar region. Azygos vein. Azygos vein is arranged between joining or connection between the superior vena cava and inferior vena cava. This is inferior vena cava. This is superior vena cava. This is right and left bronchocephalic vein. Right brachiocephalic vein. Left brachiocephalic vein. Right and left brachiocephalic vein join to form superior vena cava. Azygos vein at the level of 4 thoracic vertebra drain into the superior vena cava. Azygos vein means unpaired vein, means single vein. Azygos vein is a single vein. Occupy upper part of the abdominal wall and posterior part of the abdominal wall. Upper and posterior part of the abdominal wall. Means azygos vein present in upper and posterior part of abdominal wall. It connect superior vena cava and inferior vena cava. It also connect portal venous system and cable venous system, vertebral venous system. Azygos vein is formed by union of three. First, lumbar azygos vein. Lumbar azygos vein. Second, right ascending lumbar vein. Right ascending lumbar vein. And third, right subcostal vein. Formation of azygos vein by three. First, right subcostal vein. Second, lumbar azygos vein. Third, right ascending lumbar vein. Formation of azygos vein. Azygos vein ascend up and the lumbar azygos vein descend down to attach with the inferior vena cava. Azygos vein ascend up and it pierces the thoracic wall by piercing through the diaphragm at the level of T12. At the level of T12 thoracic vertebra, it pierces the diaphragm and open through the aortic opening of the diaphragm to ascend into the thorax. Azygos vein then ascend up to the 4th thoracic vertebra, where it arch. Arch is present at the level of 4th thoracic vertebra forward and into the right lungs. End by joining posterior aspect of the superior vena cava. Posterior aspect of superior vena cava, the azygos vein join and before piercing the pericardium. Azygos vein before piercing the pericardium. Azygos vein before piercing the pericardium, it open into the posterior part of the superior vena cava. Azygos vein arched at the level of 4th thoracic vertebra. Tributaries. Tributaries of azygos vein. First tributaries is right superior intercostal vein. Right superior intercostal vein. Costal vein. Right superior intercostal vein is formed by 3rd, 2nd, 3rd and 4th posterior intercostal vein. 5th to 7th. 5th to 11th posterior intercostal vein, right posterior intercostal vein. First tributaries 4, 5 is 5th to 11th subcostal, 5th to 11th posterior intercostal vein, 5th to 11th right posterior intercostal vein. Second tributaries. Third tributary is hemiazygos vein. Hemiazygos vein H4 hemiazygos vein. H4 heavy. Then hemiazygos vein is present below. Heavy thing always come below. So hemiazygos vein is heavy. Accessory. Hemiazygos vein. A4 above. The accessory hemiazygos vein present above. Heavy. H4 heavy. Hemiazygos vein present below, because heavy thing always come below. This is 6. This is 7. Formation of azygos vein. 1, 2, 3. Tributaries. These of azygos vein is 4, 5, 6, 7. Right bronchial vein. Right bronchial vein. Tributaries of azygos vein is formed by fourth right superior intercostal vein, fifth to 11th right posterior intercostal vein, sixth hemiazygos vein heavy, accessory hemiazygos vein, and right bronchial vein. Tributaries of azygos vein. Relation. Anteriorly esophagus, posteriorly, in posterior lower 8th thoracic vertebra present, or right posterior intercostal artery. Right posterior intercostal vein parallel to posterior to this right posterior intercostal artery present. So in posterior relation of azygos vein, right posterior intercostal artery present, and lower 8th thoracic vertebra. To the right, right lungs, right lungs and pleura present. And great splanchnic nerve is present. To the left, anterior, posterior, to the right, to the left, thoracic duct, esophagus present in the upper part. Thoracic duct and esophagus present at the upper part. Courses of arch of aorta. Courses of azygos vein. Azygos vein enter the thorax by passing through the aortic opening. This is aortic opening. Aorta is present. Aortic opening of the diaphragm at the level of T12. At the level of T12, azygos vein ascend up and enter into the thorax by piercing the aortic opening in the diaphragm. This is the opening of diaphragm at the level of esophagus, inferior vena cava, and aortic. Now we discuss hemiazygos vein. Hemiazygos vein is called the inferior hemiazygos vein. Hemiazygos vein is called the inferior hemiazygos vein. It is the mirror image of the lower part of the azygos vein. It formed by the union of left lumbar azygos vein, left ascending lumbar, and left subcostal vein. It ascends up, and its tributaries is 9 to 11th posterior intercostal vein. Tributaries is 9 to 11th posterior intercostal vein and esophageal vein. Course. Pierce hemiazygos vein Hemiazygos vein appears at the level of left crus of diaphragm and ascend into the left side of the vertebra. Vertebrae present mid-side appears and present at the left side of the vertebra and overlap by aorta. एओर्टा को ओवरलैप कर देगा और ये एट थोरेसिक वर्टिब्रा के लेवल पे ये राइट टर्न करेगा और ये जाके अटैच हो जाएगा एजाइगस वेन और ये प्रेजेंट होगा हेमियाजाइगस वेन इसोफेगस और थोरेसिक डक्ट के पीछे. असेंडिंग हेमियाजाइगस वेन जो है वो सुपीरियर हेमियाजाइगस वेन है. ये मिरर इमेज है एबव पार्ट ऑफ द एजाइगस वेन, अपर पार्ट ऑफ द एजाइगस वेन. इसके कोर्स क्या है कि ये 5th, 6th, 7th और 8th लेफ्ट पोस्टीरियर इंटरकोस्टल वेन से फॉर्म करता है और ये 8th थोरेसिक वर्टिब्रा के लेवल पे राइट टर्न लेगा और जाके एजाइगस वेन पे अटैच हो जाएगा और ये एओर्टा और थोरेसिक डक्ट के पीछे होता है. इसके ट्रिब्यूटरीज हैं 5th to 8th पोस्टीरियर इंटरकोस्टल वेन एंड सम टाइम लेफ्ट ब्रोंकियल वेन. हेमियाजाइगस वेन inferior hemizygous vein. Formation left lumbar azygos, left ascending lumbar, left subcostal. Tributaries 9th to 11th posterior intercostal vein and esophageal vein. Course pierces left crus of the diaphragm overlap by the aorta it turns right, pass behind the esophagus and the thoracic duct, joins the azygos vein. Accessory hemiazygos vein. Superior hemiazygos vein. Formation और course pass behind aorta and the thoracic duct and join the azygos vein. Tributaries 5th to 8th left posterior intercostal vein, sometimes the left bronchus vein, bronchial vein, sometimes A4 accessory hemiazygous vein. A4 above, present above, so 5th, 6th, 7th or 8th. Left posterior intercostal vein is the tributaries. H4 heavy. H4 hemiazygous vein. H4 heavy means present below, so it is tributaries in 9, 10, 11th posterior intercostal vein and esophageal vein. It turn right by passing behind the esophagus and the thoracic duct and join the azygos vein at the level of 8th thoracic vertebra. 8th thoracic vertebra and 4th thoracic vertebra landmark is very important. Asked in NEET PG as well as in MCQ. Azygos vein formation of azygos vein by 1, 2, 3, right subcostal vein, lumbar azygos vein, right ascending lumbar vein. Tributaries of azygos vein is by right superior intercostal vein, 5th to 11th right posterior intercostal vein, hemiazygos vein, accessory hemiazygos vein above. First posterior intercostal vein is from the right bronchocephalic vein. Left first posterior intercostal vein from the directly from the left bronchocephalic vein, and left superior intercostal vein is directed from the left bronchocephalic vein, but in the right side, right superior intercostal vein is come from the azygos vein. This also asks in MCQ. Thanks for watching my channel. Do like, subscribe and share my channel. Thanks.